Howdy friends, it's Wednesday, May 6th, 2020. I'm your city manager, Seth Sumner, here with your daily COVID-19 update. We're now going on 50 days since we first started reporting these videos with these updates using the Tennessee Department of Health's data collection just to report to you what's going on here in the friendly city in our local community. And also we've been able to bring on guests to talk about how people have been affected throughout our community and how we could be of help to our neighbors in need, especially during this time. Let's start with our Tennessee Department of Health numbers. We're looking at now 13,938 cases, an addition of 248 more Tennesseans now testing positive with COVID-19 since the beginning of this pandemic several weeks ago. Good number we like to see. We want this to eventually be very close to this number, is that 6,564 Tennesseans are now fully recovered. And now, I know folks keep asking, we've answered this question a few times on this update, but folks are maybe tuning in for the first time and are wondering about what does fully recovered mean. Fully recovered is specifically defined on the Tennessee Department of Health website, on this website, that explains to us the Department of Health is looking at so many days since exposure, and they haven't been listed as dead. They haven't died from COVID. And so it's an assumption. It's not necessarily that they went back and got tested a second time. That could have happened, but it's an assumption that's made by the Tennessee Department of Health that once someone has it, and if they do not die from it, then they are recovering from it. So 208 Tennesseans are added to this recovery list today, and we're happy to see that. We're happy that those folks are able to fully recover. And we've seen the majority of folks here in Athens that have had it over that 21-day period that they have been fully recovered. And so we'll get to those McMinn County numbers in a minute. I do want to again continue to cheer on our Tennesseans, Athenians, McMinn Countyans, that we're able to continue getting tested. Free tests available at our local health department. So if you're interested in getting a test, it's available to you for free. Please go. It's a drive-through process, and you can get that taken care of in a matter of just a few minutes, and you can get your results back within a couple of days. So please take advantage of that free testing. We're seeing over 227,000 Tennesseans now have been tested for COVID-19. That will continue to increase in the days ahead as more and more populations, especially our vulnerable populations in our nursing homes and long-term care facilities, as well as the prison population, are both being concentrated on right now to get those tests done. Unfortunately, we've added 65 more Tennesseans to our hospitals using those local hospital resources across the state of Tennessee. That has led to 1,221 Tennesseans that have required acute care because of their symptoms from COVID-19 since the beginning of this pandemic. We're sad to report that we've added 13 more Tennesseans to the death toll from this novel coronavirus now. Our thoughts and prayers are with those families that have been affected. We know that there's typically underlying health issues with persons, and that's why we have to be careful. That's why we have to love our neighbor and do our part by staying apart right now. We've got to continue doing that, folks. 239 deaths. That's Tennesseans, that's family, that's friends, that's neighbors who have died because of this virus. And I hope everyone is taking that seriously. So let's look at the data dashboard again from the Tennessee Department of Health. Another way to look at it, across the state of Tennessee, we continue to see Shelby County and Davidson County have the most numbers. They also have the highest population, right? So, but you can see the metro area has a higher concentration here around Nashville, Davidson County. And then we did talk about our outlier here in Bledsoe County, 601 being shown there, and that's largely because of the prison population there, and they have went in and performed those tests. And so we come and look over at McMinn County, we have 107, so we're continuing to increase those numbers here locally. Let's scroll down, and so we can see our trajectory here where we started actually getting test results in early March, and you can see how the pandemic, what our numbers look like day to day, and you can see it was at this point that we were expecting that we were on the backside of this. The pandemic surge the week was scheduled here. This was not scheduled, I'm sorry, that's the wrong way to say it. That the surge was projected to occur at this point in time, and I think we started looking at that and seeing safe as we saw a downward trend, but then we got over to just within the last week, and we've hit some really big numbers because there are more and more tests being conducted, and we're specifically getting into nursing homes and prisons with that testing right now. Through the state of Tennessee, so we do see that huge spike right there in the last few days. So obviously, still not hitting, not flatlining, not on the back end of this. We still have to be cautious during this time that we are beginning to reopen some of our businesses. So let's look down at some more of our data here. Deceased, we're still running at a 2% rate for folks that are dying from COVID-19. We know that, here we go, age, let me get on the right side of you here. Age, we've been looking at the 21 to 30-year-olds continue to have a higher percentage of cases, but still only one death in that 2,753 person age range. So obviously 21 to 30-year-olds are typically very healthy, very active, so they are unfortunately contracting COVID but not having a death rate. They're just minimal. And then of course when we get down further in age, 21 plus, 84 of the 424 have died in that age range. That's 35%. 35%. So we know, we can look here and easily see that persons of a certain age are more likely to die from COVID and related illnesses and symptoms if they contract COVID during this time. 1 in 4, 1 in 3 having from 61 on, we have a higher likelihood of those folks dying. That's what we've talked about since very early in these updates about protecting that population, especially our neighbors. Folks, they're still out and about, still need to get groceries and medicine. Our churches, you have all been doing a wonderful job protecting our neighbors and calling on them and running errands for them and making sure that they're not coming in contact with other people, just to make sure that they don't end up as one of these deceased. We got to be careful with that population. We're running at 47% recovered now because there are more and more people with it, being diagnosed with it. That number is a little bit lower than where we were. We were at 52% at one point. Now we're back down to 47 because we have more new cases. And that's coming from prison population and long-term care centers. But there's also portions of our general population that are still transmitting this novel coronavirus, hopefully even unwittingly, to other people. So please get tested. It's free. Takes a few minutes. Find out for peace of mind for yourself if that you have COVID-19 or do not have COVID-19, so that we can continue to protect these vulnerable people in our community. This is family. These are our friends. We talked about 227,000 tests now. Let's look at McMinn County. We have 107 now. 13 of those are identified as fully recovered. And of course, the Department of Health continues to do contact tracing. So when we do encounter a COVID positive result, that person is contacted by a team that then works backwards to see where this person has been, who they've been in contact with, and then they call those contacts and make sure those contacts get tested, and they're notified that they may have come in contact with a person that has now been diagnosed COVID positive. So we are going backwards and making sure that we are contacting people who have a likelihood of being COVID positive, so they can get tested. So we have that 107. That's now 1,661 total McMinn Countyans have tested negative for COVID-19. That's wonderful. What is not wonderful is we're now seeing in the Tennessee Department of Health numbers a reflection of something that we've been aware of locally, and it's today showing up for the first time, is we now have 3 deaths in McMinn County because of COVID-19. So we continue to be concerned about this. We know that it's real. We know that it is affecting people's lives more than just their health, and more than death. It is affecting us all emotionally. It's affecting us all physically, emotionally. It's making us anxious. We've been anxious for a while, but now as businesses are starting to open up, you've driven around town Monday and every day since then, the town looks a lot different than it did this past several weeks. Folks are reopening businesses, starting to come back out, but this is no time to relax. We have to be just as cautious, if not more cautious now, in going about our daily business, making essential errands. We're still under stay-at-home order. We are still abiding by the governor's executive order, which supersedes anything that we can or could do here locally. And the governor's orders carry the weight of law. We abide in those. We're following the CDC guidelines. We're listening to the Economic Recovery Group about what our guidelines are as consumers and as business owners and as employees. We're following those guidelines because we care about each other, because it's our responsibility in our great republic to take care of each other. That's a deep responsibility that I've seen folks not taking seriously. I take that seriously because I'm a patriot. I love my nation. I love the state of Tennessee. I love McMinn County, and I love the city of Athens. I love Athenians, and so I'm going to do my part to take care of your and my health, to make sure that I do not transmit this disease to another person. I'm going to do my part to make sure that I'm being safe in everything that I'm doing. And overall, Athenians, you are doing a tremendous job. Thank you. We're still continuing to see that COVID-19 is not making it widespread among our general population, and that means we have to keep up what we're doing. We have to be vigilant in our behavior. We've got to be vigilant in making sure that we're being responsible to protect the health of ourselves and others, because we love our neighbors. We're the friendly city. That's what it's about, that spirit of taking care of each other. And we've got the best of the best right here in the city of Athens. Thank you for what you're doing, folks. A few other announcements. I was on a call with Commissioner Ezell, Mark Ezell, who is the commission of the Department of Tourism here in the state of Tennessee, and is serving on, actually heading the Economic Recovery Group, as well as my friend Sammy Arnold from Dyersburg. He's Chief of Staff over in Economic Development, and he's been pulled off to help also head this Economic Recovery Group. And so from that call today, we got a few things that I'd like to share with you, and especially our business owners and our customers, our friends out there. We now have free face masks available here in Tennessee. It's a limited supply, but there are about 300,000 free face masks right now. If you can't get one, if you've been trying, if you want one, you can get it through our local health department. They have a supply of those face masks, and so you can call the health department and get a free face mask as long as supplies last. Their number is 745-7431. 745-7431. Call the health department, get your free face mask so you can have your covering when you go out into central business or one of our businesses that have been able to reopen, so that you can be able to protect the health of others there. Those face masks are being manufactured just down the road in Cleveland. And so we appreciate the folks that are at work that have changed their jobs around to make these masks available for free to you. Thank you, folks. We also have business owners. One part of your guidelines is asking, have you had a fever, to your staff, to customers, and better than asking if you've had a fever, how about taking a temperature? We have here thermometers at City Hall we purchased a while back. They're no-touch thermometers, but you can actually take a thermal scan and you can know for sure whether someone has a fever at that time or not. And so something that's helpful to a lot of our businesses, for your staff and for your customers, for your own peace of mind, you can purchase at low cost these thermal temperature thermometers. And they are available for $33. They're no-touch thermometers, and they're also available through, you can find the link on the tn.gov, go under the Governor's tab, and then click on the COVID-19 tab, and there will be information and a link for you to purchase these thermometers, have them delivered to your place of business, and then you can have that peace of mind by knowing that your staff is safe and healthy, and that your customers are safe and healthy. So those are available to you. There have been 11,000 of those purchased in the state of Tennessee just in a few days. We also talked about on our call with Commissioner Ezell today about manufacturing, construction, office building, lodging, so hotels, about new guidelines for those businesses. They are also posted on that same website, tn.gov. Click on the Governor's tab and then go to the COVID-19 tab. You can find all of these guidelines there to help you. And also small group recreation guidelines. So that is talking about things like putt-putt, bowling alleys can start reopening as soon as this Friday. Whitewater rafting is not quite yet warm enough to probably enjoy that, but it's starting to get to that season here locally. We go down to the Ocoee. If the rafting guides, if those businesses choose to open up as soon as Friday, then they have that opportunity, and there's new guidelines in place for those small groups that are less than 10 people. It is still part of the governor's order through May 29th that there shall be no gatherings, no events, no sporting, nothing where 10 people or more are gathered together in close contact with each other. And so these guidelines help us do that to protect each other's health. So please look those up. Finally, I'd just like to talk about, as we know we have 178,000 businesses across the state of Tennessee that have been affected in some way by this novel coronavirus. And I want to say thank you to certain folks out there. Our healthcare workers, you've been taking care of us through this entire pandemic and will continue to do so. I know that's been taxing. It's been very stressful. There have been healthcare workers that have been furloughed during this time that have stepped up and volunteered in case we need their assistance in our hospitals for acute care. Thank you. Thank you for being on the front line of this and putting yourself in harm's way during this pandemic. We appreciate you. I want to say thank you to our small businesses who are enduring. They have taken a hard hit, a financial hit. A lot of our small businesses have either had to close down or have taken the active call to close down on their own to protect their customers because it's the right thing to do. And we say thank you for those of you that did that. Thank you for following the guidelines that have been produced to keep your customers, keep your staff, keep your friends and loved ones safe and healthy during this pandemic. I'd also like to say thank you to our banks out there. Our banks have stepped up in something that it was very difficult to really understand what was going on with as fast as the PPP program was rolled out. But Tennessee banks have put through the federal PPP dollars, $9 billion back into our small businesses to help keep them in operating, to help keep their staff to be able to put food on the table during this time. Thank you to our banks. Thank you to our bankers who played a role in making sure that our small businesses had that payout so that they could keep their folks safe, they could keep their folks with food on the table during this close down. And hopefully we're going to be able to come out of this in the next few weeks and be able to open back up and look back from this pandemic and obviously learn a lot of things. But thank you to our healthcare workers. Thank you to our small businesses. Thank you to our banks. Other than that, I just want you to keep loving your neighbors, folks. That's what it's about. It's about taking care of each other. It's about being a patriot. It's about doing the right